Hello friends, myself Dr. Sonali and welcome to my channel called MedRecall. 2026 is my year and let's celebrate this year with super confidence and positivity. So in this topic, we are going to learn about joints and its types. So friends, joints are nothing but articulations. They are the places where two or more bones meet. They are essential for providing movement, stability, and support to the human body. What are the types of joints? First, remember that not all joints allow the same amount of movement. Some joints are completely immobile, while others permit a wide range of movements. Therefore, joints are classified based on structure and functions. So, first we will learn about fibrous joints. Okay. So, fibrous joints are also known as synarthrosis. In this type, we can again classify these fibrous joints into three types. One is sutures and then syndesmosis and gomphosis. Remember, sutures are the fibrous joints. Okay. Then in sutures, there is no movement. Okay. Sutures don't provide any movement. There are types of sutures. The first one will be plain sutures. Okay. प्लेन सूचर का एग्जाम्पल है इंटरनेजल सूचर. You can see here two nasal bones are joined with plain suture. Then the second one is squamous suture. Squamous suture का example है temporoparietal suture. Okay, so this is temporal bone and the above it is parietal bone. The suture is joining temporal bone with parietal bone. Okay. The third one is serrated. Serrated suture is interparietal suture. It is joining two parietal bones. Then dentate suture. Dentate suture is lambdoid suture, also known as lambdoid suture. It is lambda shaped. Okay. This is joining two parietal bones and one occipital bone. Then the other one is syndialysis. Syndialysis. Okay. It is rostrum of sphenoid and vomer. Okay, it is found between rostrum of sphenoid bone and vomer. So this is ala of vomer. It is also bone and this is rostrum part of the sphenoid bone. So syndialysis is mostly asked in MCQs. Then the other type of joint, fibrous joint, is syndesmosis. Okay, don't confuse it with syndialysis. Syndialysis comes under sutures. Okay, and syndesmosis contains two types of joints, which is inferior tibiofibular joint and middle radio-ulnar joint. So, for example, this is tibia and this is fibula. Joint in between tibia and fibula is inferior tibiofibular. At the inferior portion. Okay, upper superior tibiofibular joint is another type of joint. Okay, but inferior word is important. Inferior tibiofibular joint is syndesmosis. Then middle radio-ulnar joint. Okay, this is radius and this is ulna and this is the middle radio-ulnar joint. The middle radio-ulnar joint is called as syndesmosis. Then the third one is gomphosis. Gomphosis is very easy. It is a joint formed between teeth and gum. Okay, this is tooth and this is gum, and the joint formed between tooth and gum is gomphosis. So gomphosis again is a type of fibrous joint. Now the next type of joint is cartilaginous joint. Okay, so again cartilaginous joints are also divided into two types. One is primary synchondrosis. Okay, also known as synostosis, and then secondary symphysis, also known as fibrocartilaginous joint. Okay, cartilaginous joint means they are, the name itself tells about their nature. In primary synchondrosis, also known as synostosis joints, examples are epiphyseal growth plate, okay, which is cartilaginous. Then all costochondral joints. So what is costochondral joint? Just divide the name. Cartilaginous joint which is present between costochondral joint, the cartilaginous part and these ribs. Okay. And then the first chondrosternal joint. This is sternum and this is the first rib and then this is the first costochondral joint. This is also an example of cartilaginous joint, which is primary synchondrosis or synostosis. Spino-occipital joint. This is sphenoid bone, part of sphenoid bone, and then part of occipital bone. So the joint formed between sphenoid and occipital bone is also primary synostosis or synchondrosis. Then the joints under secondary symphysis, or also known as fibrocartilaginous joints, are manubrosternal joint, which is in between. This is manubrium portion of the sternum, and then this is the remaining sternum. The joint in between, the joint joining manubrium and sternum, is called as manubriosternal joint, which is fibrocartilaginous joint. Then xiphisternal joint. Okay, so this is xiphoid process, and then this is the sternal part. It is also secondary symphysis. Then comes intervertebral disc. This is important. Remember, intervertebral discs are fibrocartilaginous joints or secondary symphysis. And then symphysis pubis. It is joining two hip bones anteriorly. Okay, symphysis, pubic symphysis. And then sacrococcygeal joints. Sacrococcygeal joints. This is coccyx and this is sacrum. Okay, sacrococcygeal joint is also known as fibrocartilaginous joints. Have you noticed? Then all these joints, which is manubriosternum, xiphisternum, intervertebral disc, and symphysis pubis and sacrococcygeal joints, all these joints are present in the midline portion of the body. है ना? If it is human body, then the midline portion of the human body, you can see this manubriosternal joint and xiphisternal joint, all these are arranged in the midline, and intervertebral disc also, that is spine, is also present at the midline, and then pubic symphysis is also present at the midline, and sacrococcygeal joint is also present in the midline. So secondary symphysis is also easy to remember. Now let's move on to the next type of joint, which is called as synovial joint. Synovial joint is having some kind of synovial fluid also, and it is highly movable. Synovial joint is helpful for the movement, and again synovial joint has many varieties, many types, and one of its type is plain joint. Plain joint, the examples of plain joint are patellofemoral joint. It is patella and this is femur. Okay, so joint between patella and femur is plain joint. Then intercarpal and intertarsal joints. Okay, intercarpal means joints in between the carpal bones, and joint in between the tarsal bones. Okay, it is intercarpal and intertarsals. And then comes costovertebral, costotransverse, and costosternal joint. Everything related to vertebra and relation of vertebra and rib. Okay, so this is vertebra, body of the vertebra, and this is rib. So the joint in between vertebra and this rib is called as costovertebral joint. Other one is costotransverse joint. This is a transverse process of the vertebra, and this is the joint formed between transverse process of the vertebra and the rib. Then the other one is costosternal joint. Okay, joint between costo and sternum, that is between rib and sternum. It is also plain joint. Acromyoclavicular joint. This is acromyon of the scapula and then clavicle. Acromyon of the scapula and clavicle forms acromyoclavicular joint, which is also a plain joint. Then superior tibiofibular. Previously we have seen superior tibiofibular joint, which was syndesmosis, which comes under fibrous joints. Okay, move on to the next type of synovial joint, which is very easy, ball and socket joint. Okay, this joint looks like ball and socket. The way how ball fits into the socket, it appears like this only. For example, shoulder joint, you can see this is the head of the humerus. Head of the shoulder is fitting inside the glenoid cavity of the scapula. Okay, the other one is hip. Head of the femur is fitting inside this acetabulum. Okay, and the other one is incudostapital joint in the ear ossicles. Okay, incudostapital joint, this is stapes and this is incus. This is malleus, incus, and then stapes. The joint between incus and stapes is called as incudostapedial joint, which is also ball and socket joint. Then other one is talocalcaneonavicular joint. Talocalcaneonavicular joint. Remember, the joint in between talus, then calcaneum, and then navicular. This is talus, then the below the talus there is calcaneum, and navicular in front of the talus. Okay, these form ball and socket joints. Then the next one is saddle joint. Patellofemoral joint functionally comes under plain joint, and structurally it comes under saddle joint. Then the incudomalleolar joint, now we saw incudostapedial, which was ball and socket. The remaining, which is incudomalleolar, it is saddle. Then the first carpo-metacarpal joint. First carpo, you can see this is the first carpal bone, and this metacarpal bone. First metacarpal bone and this carpal bone forms this first saddle joint. This first carpo-metacarpal joint form saddle joint. Then calcaneocuboidal joint. Okay, calcaneocuboid joint. We saw talocalcaneonavicular in ball and socket, and another one is calcaneum and cuboid. Calcaneum and cuboid. Okay, this is calcaneum is behind and then cuboid in front. Okay, then the sternoclavicular joint. This is the sternum and then the clavicle. It forms sternoclavicular joint. It comes under saddle joint. So sternoclavicular joint comes under saddle joint. As we can observe that the rib cage is having many types of joints. Okay, mostly they are synovial joints only. Some are plain joints and some are saddle joints also. That is, mostly they are synovial joints. The next one is hinge joint. Okay, hinge joint, it is also very easy. Hinge like movement, it occurs at elbow joint. Elbow joint is formed at this humerus, head of the lower end of the humerus and head of the radius and ulna. Okay, it forms hinge joint, elbow. Then ankle joint, which is formed again with talus and tibia, fibula. Then interphalangeal joints, these distal portion of the hand. Okay, interphalangeal joints, all these form hinge joints. Then comes, because it forms only movements in one direction. Okay, in one direction like a hinge. Then the other one is pivot joint. Pivot, there is C1, C2, that is first and second cervical vertebra. This is first one is called as atlas. This is atlas bone, which is gray in color, and the second one is axis. Okay, so this is axis. So it means pivot joint means the atlas can move around this process of axis. Okay, the other one is condylar joint. Condylar joint again contains knee joint and temporomandibular joint are condylar joints. This is knee joint, which is formed in between patella, femur and tibia, and then condylar joint between angle of mandible and temporal bone. The other one is ellipsoid bone. It is also synovial joint. Ellipsoid joints contain metacarpophalangeal joints and metatarsophalangeal joints. This is metacarpal and these are phalanx. Okay, metacarpal and these phalanx are joined by ellipsoid joints. Okay, interphalangeal joints we saw, they were hinge joints, and these metacarpophalangeal and metatarsophalangeal joints are ellipsoid joints. And then wrist is also ellipsoid joint. And then atlanto-occipital joint, you can see C1, C2 were pivot joints, and above that, which is above atlas and occipital bone, this is occipital bone and this is the portion of atlas bone, it forms ellipsoid joint. Okay, so, and this is wrist joint. it is this joint formed in between carpal bones and inferior end of the radius and ulna. So in this lecture we covered all the types of joints which are important to remember with respect to anatomy. Focus on visually capturing things better, okay? Because in exam quicker to remember image based memories rather than recalling the mnemonics. Mnemonics can cause confusion when there is hurry, so it is advisable that revisit these slides again and again and try to focus building image based memory. Thank you. I hope it will help you. Like it, share with your friends, and follow for more. Bye bye.